Today's webinar is being presented by Kelly Barnhill, the Director of the Nutrition Clinic at the Johnson Center for Child Health and Development. Kelly is a certified clinical nutritionist with over a decade of experience in the field. At the Johnson Center, she directs a team of dietitians and nutritionists that has served over 3,000 children through this practice. In addition to her clinical practice, Kelly also serves as the Johnson Center Clinical Care Director, overseeing management and implementation of a multidisciplinary care across the practice within the organization. In 2008, Kelly accepted the position of Nutrition Coordinator for the Autism Research Institute. In this role, she designs and manages curriculum and training for hundreds of nutrition practitioners each year, as well as providing direct training for thousands of parents. Kelly is a sought-after presenter, speaking at several national and international conferences each year. Her studies and work at the Johnson Center are the culmination of many years' effort and expertise, with the last several years devoted to understanding the biological underpinnings of the disorder we know as autism. Her work has raised awareness of the need for these services for children with autism and related disorders. Before we begin the presentation, please note that questions can be typed into your control panel throughout the presentation, and time permitting, they will be addressed at the end. Also, for those of you that have requested copies, we cannot send out the presentation slides. However, we do post recordings of all of our free webinars on the Johnson Center YouTube channel. Please search for us on YouTube and subscribe to get full access to all of our recorded webinars. I've also provided a link in the chat section of your control panel to find us on YouTube. We're also currently offering certificates of attendance for this webinar, and a link to complete a short quiz will be emailed to you following the presentation. I've also included this link in the chat section as well. Now please help in welcoming our presenter, Kelly Barnhill.
Thank you so much for joining us today. We're here today to talk about how to build and build upon a team of professionals and a support network, really, in helping your child with autism. Our goal is to talk about building a big picture, broad scope foundation for the best possible plan of care, or evaluating the plan of care that you currently have in place to help your child. Most treatment plans for the children that we serve are implemented, and they involve many areas of expertise and intervention. Proper planning and full information is key when you're thinking about things like that, and you need full big picture perspective across a number of different areas of expertise. This creates the foundation for all the hard work your child and you will do. This diagnostic guidance, dietary evaluation, nutrition evaluation, and intervention in each of those areas as well, potential nutritional supplementation, medical evaluation and intervention, behavioral evaluation and intervention, and educational targets are all aspects of care that are of primary importance in the children that we see and serve. For us, this makes the big picture, and different perspectives are really needed for you to come up with an informed and multifaceted plan to best serve your child. So this talk today is really geared to help you begin assembling that team and see it in that umbrella perspective, or refine your current team and look at any holes that might be there, and then consider a need for any additional team members in that process. So my goals today really are threefold. One, provide a framework and a thought process for understanding multidisciplinary case-managed autism care. And what do I mean when I say that? I really mean this is a team effort, and many of us as parents and professionals have had to attempt that on our own, and through the combined experiences of professionals here at the Johnson Center and also at Autism Research Institute, we really have a framework now that we can assist families that we serve in pursuing appropriate care for their children. I want to offer input and feedback on disciplines that we see as core autism and autism spectrum disorder care, And I also want to allocate significant time at the end for any questions to address specific concerns which you might have. So if there are specific interventions which you are here to hear about and you do not hear those mentioned, feel free to send those questions. And if we do not have time to address at the end of this talk, respond via email privately. So how do we see what goes into the makeup of who we are, how we feel, and how we behave? So many different things impact each of us on a daily basis. The amount of sleep that we have, the food that we're eating, our environment. Are we in pain? Are we pain-free? What's our emotional health like? How do we feel? What kind of stimuli is in the environment that could be distracting us or helping us stay focused? What kind of learning challenges do we face? What kind of stamina do we have? Is that a component of physical health? Is that a component of distraction? Is that a component of emotional health? What kind of resources do we have available to help us each day? What are our physical abilities? Each of these things give us the framework to think about things to do to address some of the challenges that might be present and how to build the team that you need to address each of those individually as well as creating a master plan. So how do you build a house or perform a symphony specifically to address children with autism, autism spectrum disorder, or similar challenges? A good house or symphony should include components of any or all of the following. First and foremost, a primary care physician, typically a pediatrician for most families, a developmental pediatrician, a neurologist, a speech therapist, an occupational therapist, a nutritionist or a dietitian, a board-certified behavior analyst, a psychologist, specialty physicians such as immunologists, gastroenterologists, endocrinologists, and we now have several clients who are seeing infectious disease specialists, physical therapists, teachers, psychiatrists, geneticists, technicians, teachers' aides, etc., and that list goes on and on. Ultimately, everyone's list will look a bit different. All of these people play a role, and if something's missing from your team, I hope that this talk will give you a little bit of guidance on what you might need to add or who you might need to add to complete the picture. Why is this important? We all bring our own perspective and our own area of expertise to the table. This provides you, as a parent, as a case manager, as a professional, an array of knowledge and expertise which no single person possesses. You are able to get different, informed, educated perspectives in this fashion. Acknowledge this early in the process with your child. Respect individual perspectives, but be thoughtful and considerate in adopting any single individual's advice across the board. So be cautious, particularly if that advice comes from a place without full information or comes outside any said professional's area of expertise. So remember, different team members bring different expertise to the table and value them for the knowledge and the experience that they have. So what role should your primary care physician play here? I can't reinforce enough our belief that you really need to respect and rely upon your pediatrician. You have to have a good relationship there. If you don't, I strongly encourage you to evaluate it. You should be in a supportive, understanding, and compassionate relationship with that individual. Don't be resigned to it if you don't have that. Ideally, you see this person for the duration of your child's young life or your time in any specific community. Do not settle for first-line pediatric care that is unfamiliar completely with autism and autism treatment. If you do not have a relationship built on mutual respect and understanding and communication, change that immediately. Either open the lines of communication with that individual and be completely honest, or find a new physician. Expertise in primary care is what you want from this individual. You and your child need a solid medical home. Your pediatrician can and should play a central role in well-child decisions, in acute care situations, and referrals for complex conditions. How do you find a supportive and solid frontline practitioner? There are a number of complementary and alternative medical practices. The American Academy of Pediatrics has a subgroup that has a number of members that, if they're not located in your local area, might be able to provide more information. There are a number of integrative practices. So there are family practice physicians who can provide and do provide solid pediatric care. There are functional medicine practices that provide primary pediatric care. You can look at referrals from support groups. You can look at referrals from other providers, such as your occupational therapist, your speech therapist, or your physical therapist. Ask other parents. Be diligent in doing this. Ask your child's specialist. If you've already been referred out for care with a neurologist or an endocrinologist or a geneticist, be honest in asking for advice and referral information to a pediatrician who might better suit your needs than the one you currently have. What comes next, and who else should we consider on this team? A developmental team is really important. A developmental pediatrician plays a role in appropriate diagnosis for your child, and that's crucial in moving forward, I think. It either allows you to establish a baseline or evaluate current status for your child. So it provides a time point 0 or time points along the way, and many of us neglect to follow up with evaluations to see how our child is progressing and where we're going. But I think it's of vital importance that we really think about keeping an eye on the ball there and and really focus on ongoing diagnostic care throughout your child's experience. A developmental pediatrician can also recommend a treatment plan and intervention strategies depending on the developmental pediatrician's role, both in their practice and also in the community. This is a great start for entering appropriate care, for monitoring progress, and assessing need for change. So does your community have a developmental pediatrician? Many actually don't. Developmental pediatricians who see clients clinically are typically associated with teaching hospitals, university hospitals, and multidisciplinary diagnostic teams. If you have not seen a developmental pediatrician, I encourage you to look for one. Even here in the state of Texas where we are, many families travel primarily to Houston or Dallas for appropriate developmental pediatric workups. We do have developmental pediatricians in other pockets of the state, but those developmental pediatricians tend to be focused on very specific diagnoses and will often only see a child with certain developmental diagnoses, not a child with autism, for example. If you have had the opportunity to see a developmental pediatrician and a developmental team, I encourage you to dig out that evaluation, check to see where you are in context to it, and if you're 2 or 3 years out from it, consider getting another evaluation completed on your child so you kind of have a status report and understand where you are. This is a building block that helps you move forward in providing appropriate care for your child. Who else is important on this team? I mentioned this a little in that developmental pediatric evaluation, but a diagnostician is crucial. It is imperative that you get an appropriate and comprehensive diagnosis. That's how your child will be best served in the long run. Who can offer you that? Developmental pediatricians often provide comprehensive diagnostics, psychiatrists, psychologists, some neurologists. And what do you do with that information once you have it? We've actually had several, we have given several talks on that, which you can find on our YouTube channel. You can also refer to this blog entry, which is on our blog, johnson-center.org, and if you just look for developmental evaluation, you'll find a good deal of written information there. Many parents shy away from a diagnosis, or they don't believe that it's vitally important, but there's no reason to be scared of an appropriate diagnosis at this point in time. It gives you information to make critical decisions for your child's care. It may provide opportunities for support and assistance, such as insurance, and it provides you a ticket. This is crucial for you and your child so that you can access development and the effectiveness of your interventions. It allows you to address your child's specific ongoing needs most effectively. Many parents feel like this diagnostic step will either hinder or hurt their child in the future, and I can tell you, I appreciate your caution, but in many years of professional experience, working with many different children, we just really haven't had that experience here. Don't be afraid to ask questions of any diagnostician that you seek out. Ask which diagnostic instruments they'll be used, why, how have they chosen those, how familiar are they with those instruments, what type of information will be provided in a diagnostic report. Ask if they'll be providing a comprehensive evaluation and also recommendations. Some evaluations will get you a diagnosis based on appropriate diagnostic criteria that are outlined in various instruments, such as the now DSM-5. Others will give you that, as well as recommendation care and intervention, such as X number of hours of behavioral intervention and X number of hours of speech therapy in conjunction with recommendations for further medical workups if necessary. What about medical management? We believe, and we're really built on the belief, that the biological underpinnings of autism can't be ignored. And we strongly encourage families that we work with to seek out medical specialists who can help them offer a full evaluation from a systemic perspective of their child's physical health. Where can you find those practitioners? The Institute for Functional Medicine, and their website is functionalmedicine.org, offers training for professionals in providing an appropriate sort of systemic evaluation for many individuals. The caveat for me here is that this is a perspective on medicine practice. It's not necessarily focused pediatric care or focused autism care, but I think this is a good starting point to look for physicians who might be able to help you locally with your child. There are a number of different American Academy of Pediatrics reports out. The most recent one on GI help was about 3.5 years ago. And that report, if you can find it online with this information here, will get you to some of the leading experts in gastroenterology in treating children with autism. If you have questions about that specific area of expertise, so comprehensive medical care for chronic symptoms. This piece overlaps with your pediatrician. Sometimes these roles are played out by different individuals with differing areas of expertise. It's reasonable to assume, based on what we know from research and clinical practice, that there are chronic health concerns associated with some of the children that we see. Is your child often ill? Has he ever been evaluated for immune status and immune function? Does your child have any ongoing GI concerns? Our recommendation is that you need to find a practitioner who's educated in investigation of those concerns, particularly with children with autism, and see that individual for a full workup for your child. That practitioner may then be able to lead you to others with expertise in the treatment of medical conditions associated with autism if they are unable to provide full picture medical investigation. The next person that I think you really need to speak to in creating a full picture perspective is a nutritionist or a dietitian. This plays a fundamental role here at the Johnson Center because we really believe that nutrition is foundational for a child's ability to be healthy and learn. And we want the children that we serve to have full access to every therapy that their families invest in. So we really feel like many children that we see come to us with dietary preferences that create nutritional concerns, and we feel like those need to be evaluated. If a child is dietarily complete and we don't have any concerns, both about current nutritional status, about dietary intake, or gastrointestinal concerns, that's data that then allows other medical professionals to move forward in care. If we do uncover through that process some deficits or insufficiencies, we have the ability to address those and perhaps improve status for the child that we're seeing. I encourage you to find a knowledgeable and experienced practitioner who can appropriately evaluate your child. That involves a nutrition physical, collection of a 3-day food diary, analysis of that food diary for complete macronutrient and micronutrient status. And then, after all of those things occur, recommend an intervention plan for your child if one is necessary. You want all of this information from a credentialed professional with experience working with children with autism. There are a number of different licenses available now, an RD, an LD, nutritionists with a number of different letters behind their name, and my advice is to seek out a professional who has training, expertise, and licensure to assist you in building this plan. It's most important to find someone who knows about autism, because that's where I think you will build the most appropriate piece of this puzzle. Don't be afraid to ask the hard questions. And don't be put off by financial constraints. State that up front. We know nutritional guidance and nutritional care, dietary guidance and dietary care can and is often not covered by insurance plans. Or if it is covered, it is not covered to an appropriate extent so that families must foot a large portion of the bill for this service. I encourage you not to minimize the importance of this piece. If you need financial assistance, ask for help. There are organizations that provide underlying funding for you if you need it to be able to cover more than a standard copay, for example, for service access. It's really important, and I wouldn't minimize it because it's a stretch or a reach based on insurance coverage or lack of that. It's meaningful data and intervention which will serve your child well. Behavioral intervention is a key component of any treatment plan for autism. We know now that multiple studies have demonstrated early intensive intervention improves learning, communication, and social skills. All good early intervention programs share certain features. Number one, the child receives structured therapeutic activities for at least 25 hours per week. These therapists and/or teachers deliver the intervention, which is often on a one-to-one basis. The therapy is guided by specific and well-defined learning objectives, and the child's progress in meeting these objectives is evaluated on an ongoing basis. Intervention focuses on core effects such as social skills, language and communication, imitation, play skills, daily living, and motor skills. We believe in and focus on the use of applied behavior analysis under the direction of a board-certified behavior analysis here at the Johnson Center. We believe that documented and appropriate intervention for children with autism is appropriate, as it is for all children, really. It's a scientific approach to shaping and altering behavior. All children, in our opinion, can benefit from an appropriate ABA program. A program provides the child with opportunities to interact with typically developing peers. In many cases, it actively engages parents in the intervention. Therapists can make clear their respect for the needs, values, and perspectives of the child and his or her family, and it often involves a multidisciplinary team that also includes a physician, an SLP, an occupational therapist, a physical therapist. So our recommendation would be to find an appropriate provider and get on waiting lists as soon as possible, as behavioral intervention tends to be a lengthy application, evaluation, and initiation process. I have a couple of slides here that I wanted to share with you just to show you the impact from a visual perspective of appropriate of a child's learning needs. So this, if you follow this trajectory of the blue line, this represents a typically developing child, so that at age 1, a child has approximately 100 skills that they've learned. At age 2, approximately 250. Now follow this line. This represents a child with autism, and you will see that the gap at between age 1 and 2 is there, but slight. Between age 2 and 3, it's growing, and 4 and beyond, it continues to grow at a pretty significant pace. So for us, if you want to start intervention and directly teaching these skills that a child cannot pick up from their environment, at age 2, the gap you're closing is shown by the green arrow on the left of the screen. If you wait, you're looking at a gap like this, which is fairly profound and requires a lot of time, effort, energy, and resources to close, whereas if you begin early, the power of that is not lost. I also want to point out something that our executive director thought through a few years ago, and as we were problem solving, because we needed a visual tool to really help families understand when someone recommends 25 hours a week or 30 hours a week of behavioral intervention for your child. That sounds excruciating and excessive, but it's really not when you break down a day in the life of a typical toddler. So what happens throughout this day? There's a window in a schedule throughout the day to play and learn. If you add up these hours throughout the day, which are broken up appropriately with meals and sleep and time together, you come up with many, many hours available in windows of opportunity throughout the day that can be targeted behavioral intervention. Those are windows of time where you are able to schedule blocks of learning if necessary. So it might not look like a 9 to 3 school schedule necessarily, but it is a whopping almost 6 hours a day or 40 hours a week that you could conceivably set up constructed play and learning time. And I think when you think about it in this construct, it becomes a much more manageable approach to visualizing and understanding, okay, how do we make this happen for our child without it feeling overbearing? What are other components and who else should be on this team? Occupational therapists and occupational therapy play a role here in many of the children that we see. These services focus on enhancing participation in the performance of daily activities like feeding and dressing. Other activities associated with daily living, such as safety, things like education, work, leisure, play, and social participation. All of those fall under the purview of occupational therapists in their approach. For an individual with autism, occupational therapy services are defined according to that person's individual needs and goals, and that, as well as the parents' goals for participation. These services include evaluation, intervention, and measurement of outcomes. Throughout this process, occupational therapists can collaborate with the child, the family, caregivers, teachers, and all other team members. These services can focus on personal development, quality of life, and the needs of the family, and incorporate all of those things. So if your child has any sensory integration concerns, any balance or coordination concerns, gross motor skill concerns, fine motor skill concerns, any vestibular concerns, or is the child overreactive, underreactive to their environment? If you can answer yes to any of those questions, an evaluation with an occupational therapist might give you more concrete data to focus on specific intervention to address those issues. In terms of physical therapy, physical therapists focus on problems with movement that cause functional limitations. Children with autism often have challenges with both gross and fine motor skills in things specifically like sitting, walking, running, and jumping. They look at addressing poor muscle tone, balance, and coordination. Much like an occupational therapist, a physical therapist will start by evaluating the child's developmental level and abilities. They'll identify challenges and design activities to target those specific areas of concern. This might include assisted movement, various exercises performed both in the therapy session and also at home. It could include any orthopedic equipment that the physical therapist or treating medical professional might deem necessary. It's usually delivered in 30-minute to 1-hour sessions by a certified therapist, and the frequency is determined by the needs of the child. Many families that we see a physical therapist twice a week on an ongoing basis for chunks of time with reevaluation at the 3-month and 6-month levels, and often transition out of that care as they grow. Speech therapy focuses on the development of a means of communication and articulation concerns for the children that we serve. It encompasses a variety of techniques and addresses a range of challenges for children with autism spectrum disorder. Children that we serve can be both verbal and nonverbal. They can have difficulty understanding information that's shared with them. They can also have difficulty using language to express themselves. And a speech-language pathologist will begin an evaluation and then create a plan based on that evaluation. It's often offered in a one-to-one setting with the therapist and the child in a very contained environment until the child can move into a larger setting. If speech therapy is offered in a school setting, it's often offered with a small group or in a classroom setting. Depending on the verbal abilities of that child, the goal might be to master language, or it might be to learn facilitated communication or signs and gestures to be able to express their needs. For each individual, the aim is to help that person gain the most appropriate mechanism and for useful and functional communication. One emerging, I encourage you, specific speech-language therapists, to look into that area, because we have a number of children who have made great progress from an articulation perspective with that particular intervention. Who else needs a place at this table and on this team? Children under the age of 3 are served by early intervention specialists and early intervention programs throughout the country. That's a federally funded program that can be implemented by any number of institutions locally. Some areas, school districts provide early intervention service. Some areas that is provided by nonprofits. It really depends on a regional and local approach to what those services are. Whatever your child's age and wherever you are located, I encourage you to find your local early intervention specialist if your child is under the age of 3 and request an evaluation immediately. The evaluation process alone will provide you with information should you and open a door to further services for you just through that one call and the one evaluation of your child. This will, in the early intervention area, under the age of 3, create something called an IFSP, which is an individualized family service plan. And in the school setting, it's called an IEP, an individualized education plan. I encourage you to build a collaborative relationship with your school or your early intervention provider because you need that communication to be a two-way street. These are individuals who will be responsible for educating your child for as long as you are in the community where you currently reside, and you want that to be a mutually supportive and respectful relationship. Having said that, I also encourage you to know child rights. Know what an IEP or an IFSP is and the procedures and protocols that govern that. Know the rules that are specific federally and also to your state. If you are in unknown territory here, I encourage you to seek out advocates and ask for referrals on how you can educate yourself. When thinking through where to go to begin services or to augment services that are currently in place, I encourage you to educate yourself, document any concerns, requests, and don't hesitate to speak up. You won't know the answer to your question unless you ask it. Involve your BCBA if you have an ABA program in place. Involve your OT, your ST, your PT, so that what is being done at school is consistent with anything that you're doing out of school. And certainly, if your child has any medical or nutritional concerns that your school should be made aware of, fully inform the school, and if possible, information included in the IFSP, and also that your child's medical and nutritional needs can be met in those confines as well. I can't say enough how important we feel support groups are for families who are facing an autism diagnosis for the first time or who are walking this path. The Autism Research Institute has been instrumental, really, in building information for professionals and parents. I encourage you to look at the website, autism.com. You can also look at their YouTube channel because there are a number of different references and resources there so that you can educate yourself on some of these issues that I've just mentioned. I encourage you to look at the Autism Society of America's website. Autism Speaks is another important group that has many different resources available. Look at community groups. You will find many resources at schools, at churches. Many private therapy providers now have support groups for their families at local nonprofits. Find other people who are doing what you're doing. Make friends and understand and learn from them, because you don't need to walk this path alone. If you're pursuing any number of dietary interventions, there are a number of different groups out there, whether they're virtual groups that are available on the web, or they're local or regional groups that meet at the city or statewide level. Find a group that will help you make this as easy and as tight as possible for you and your child. So, in saying that, I also think you need to figure out what advice you need to take. Consider your source, do your homework, and ask your clinicians. Where is the information that you're using coming from? It is important to be aware of and acknowledge our own bias in this as well, I think. It's human nature that when a finding is consistent with what we believe, we aren't as critical of that information that is being presented, and we accept it as truth. The reverse is true as well. If a great study demonstrates the opposite of what we believe, we are more often quick to be critical and dismiss it without an objective reason why. Get used to playing the devil's advocate on your child's behalf, even with yourself. Know where your information is coming from and look at it with a critical eye. I touched on this briefly earlier, but many children need or should be involved in specialty care from a medical perspective. Many of the children that we work with require assessments, if not ongoing treatment, by gastroenterologists, immunologists, endocrinologists, geneticists, because all of those areas of expertise will then provide us data, information, and resources to best serve that individual child. By allowing these professionals to do what they do best, you get the best of who they are and what they do. Asking each of them to take on a bigger picture outside their own wheelhouse and training will invariably dilute their quality of care. Get the best from your team. Nobody that I know can stay 100% up to date on everything that's coming forward as quickly as it is now in the professions and the fields that we've listed. And when building our house, we have to evaluate and assess information from a number of different areas. We cannot ask people and professionals to weigh in and have the final say and voice on an area that's outside their area of expertise. When we ask someone to treat in an area that they're less familiar with, we're asking too much of them, and it sells your child short. And by doing that, I really mean, please don't go to your neurologist and ask about gastroenterology care. You can ask for an opinion on a report, perhaps, and how it might impact a medication or another intervention that you're choosing with your child from a neurology perspective. But unless your neurologist has a global functional medicine perspective and is really trained in thinking about body systems, you're doing that professional and your child a disservice by expecting advice from someone who might be offering an expert opinion outside their area of training. Let people do and focus on what they've been trained to do. You wouldn't go to your surgeon to fix your car, and nor would you want your mechanic to do your bypass surgery. Let people use their knowledge and training to do what they do best. Don't ask your nutritionist to develop your behavior plan, and don't ask your behaviorist to give you any medical advice. Let people do what they do best to make this big picture for your child. Get comfortable asking lots of questions. The important thing is to be comfortable with what you're doing and understand why you're doing what you're doing, and that you clearly understand what the plan is. Ask lots of questions. Why are we doing this? What problem are we solving? Is it useful? Are we adding value? Will it change behavior in any way? Is there an easier way? Is it worth it? If each member of your treatment team is doing what they do well and not stepping outside of their own expertise, you should hear "I don't know" from time to time. Embrace that. Know that this is okay and actually meaningful. As long as you have individuals on your team who are willing to help you find the person who does have answers, you're doing a good job. So what are the caveats in all of this advice here? Look for and acknowledge any bias that might be present. Be aware of any profit-driven motive. Respect the expertise of every team member that you've entrusted with your child, and believe and hope that they will do the same for each other as well as you. Think critically, cautiously, and carefully about every decision that you make for your child. So I have about 10 minutes left for questions at this point. I think I'll take a break for just a second. We will see if any questions come through, and we can talk about both specifics of anything that I have spoken on here today, and I can also answer any questions that you have about specific interventions to the best of my abilities that may fall under this umbrella. The first question that's come through is, my grandson has Down syndrome and a diagnosis of autism. Are you aware of any physicians in Texas who specialize in this type of dual diagnosis? Yes, we work with several physicians here who do manage both a Down syndrome and an autism diagnosis. If you can contact the Johnson Center front desk and ask for me specifically, I can give you a list of referrals. What do you count as targeted behavioral intervention? Just ABA? It's an interesting question for us because I believe that there are a number of different behavioral-based intervention strategies that we break out and parse out as that are successful components of any ABA program that I would see. So I believe, for example, RDI is a component of a solid behavioral intervention program. So I do believe that and we believe and are built on the idea that behavioral intervention needs to be solid, measurable. But from a structural standpoint or a, I guess, philosophical standpoint, as long as behavioral intervention is provided by a highly trained individual who can measure their outcomes with a behavioral base, I'm willing to, we have an open mind about what that looks like, whatever label individuals like to put on the services that they provide. There's a question here regarding how parents should cover the cost of services that are not paid by insurance. I'm curious, in the conversation and in my presentation specifically, I mentioned seeking out and asking for help, cost of services associated with a dietetic workup, because that's often not covered by insurance. We know now that there are resources available So, for example, if you have a child under 3 who needs a dietetic workup, and there's evidence for that, and most of the children that we serve, there is evidence for that, you can look at local resources to assist with that. So if you've exhausted your insurance approach, then I suggest you look at things like Any Baby Can or other providers who can help you with the cost of an appropriate workup there that can be then outsourced to an appropriately trained professional. I think you can also think about, we do a lot of work with families on grant writing and proposals, because there are funds available if you know where to look for them and if you seek them out in earnest and help. There are lots of groups that will help you help your child. We encourage families to be creative in how they seek funding. We coach families through how to do fundraisers to support their child's care. We have a family care coordinator who often has that conversation with families. Like, this is a very expensive journey. How do we do it successfully? And we have someone here within our walls that helps hold families' hands, and I know that she has resources and lists available that she shares regularly, and I believe we have some of that information on our website as well. Another question regarding pediatrics and autism treatment. Yes, it's very difficult to find pediatricians who are well-versed in autism treatment, and our experience has been we see wonderful practitioners who really understand the global scope of looking at this as a medical issue, particularly if they have a child who has had a number of upper respiratory or ear infections, who's had constant gastrointestinal concerns for 2 years of life, and they see it really as a medical issue. It's easier for those practitioners to be open-minded about an approach. I strongly encourage you, if you have difficulty finding a professional who is open-minded and that you can have a real two-way conversation with that's meaningful in your child's care, to look for another. And I refer you again to the Institute for Functional Medicine website. You can look at the American Academy of Pediatrics Complementary and Alternative Medicine subgroup for options on pediatricians throughout the country. You may look at the autism.com website and contact information there for pediatric referrals in many cases. You can contact our offices here at the Johnson Center, and perhaps we'll be able to help you if it's local or regional. But we serve kids from all over the country, and we have a network now of families who can give us information if we don't have that readily available. So I'm happy to share that with you as well. There's a question regarding Autism 360. Autism 360 is a website and resource that was established by Dr. Sidney Baker. It's created to share, for families to be able to share information and also to understand how other families facing the same hurdles have solved their problems, and also look at really diagnostically similarities between medical experiences, nutritional experiences, and therapeutic experiences. And you can find that, austin360.org, I believe, is the website. I know there are other questions coming in right now, but I cannot see all of them at the moment. There's a question regarding what do you do when you believe you've done it all and nothing has really helped? I hear that question often, and I really tell families, get another set of professional eyes from an individual that you trust to look at the whole everything, to look at the big picture, because I believe everyone who walks in our door and says we've done everything and we've had minimal success, and I understand too how frustrating and disappointing that might be, and I encourage everyone to say, okay, bring every document in, go through every piece of paper, look at what that timeline is, put it together, and see what might be missing. The more we learn and the more preliminary research that's coming out now, we know the synergy of certain interventions from both a medical and also a therapeutic perspective. So for example, families will come in and say to us, well, you know, we tried that vitamin support and it didn't really help. But what we know now is that before a B vitamin supplement might help, for example, there are other vitamins that need to be in place and well supplemented, or your child might have a severely negative reaction to it. So all of the pieces really need to fit together, and someone who has, one, not been involved in care up until the point where you're saying, okay, we need another set of eyes, and two, someone who has experience in seeing the big picture could be very helpful in evaluating and helping define what might the next step be. There's a question regarding the best protocol when looking for specialized medical care. Do you ask for referral to a specialty at a time, or do you do everything at once? Can a general practitioner run certain tests to have a base work for which practitioner to go to? That's a very good question, because I think, unfortunately, it's on an individualized basis. If your child has gastroenterology concerns, if your child has, is 2 years old and has never had a formed stool in his or her life, I would ask your pediatrician for a gastroenterology referral. That's a good start. Beyond that, I would ask for a referral to a nutritionist or a dietitian who might be able to help you tease out from a dietetic perspective what's going in that might be disturbing your child's GI status. If you have a child who, many screens, for example, many pediatricians don't do any blood work screening up front with very young children unless it's highly necessary. But if you have a child who needs a full workup from a medical perspective with a geneticist, for example, there will be a number of different screens run there that can then direct you to other areas of specialty if needed. So a typical panel might include work looking at thyroid function, for example. And if a thyroid panel comes back with low thyroid function, you'll be referred to an endocrinologist who can manage and treat that appropriately. So I would say the best place to start is talk to your pediatrician, ask for a functional medicine referral, talk to that functional medicine provider about intervention and treatment options based on your child's individual health history, and go from there. The next question says, our doctor believes our 9-year-old son's only issue is the social aspect of autism. Can this really be? Isn't autism a multifaceted issue? They say the only thing that we can do is ABA. We should not worry about nutrition, despite the fact that he's super skinny and he hasn't grown in the past year. So based on that information, I would say to you, number one, get a copy of your child's growth chart and see what that growth trajectory looks like over time. I would track your child's dietary intake on your own. You don't need professional guidance to tell you to track what he's eating. And then look at that, use that data to have a targeted conversation with your pediatrician, because I believe that's a good place to start. I think that, and our belief is that autism certainly is multifaceted, and I don't think that until you've evaluated concerns, you can rule that out. The next question is, can you address to what extent an MTHFR mutation affects autism? I wish I could, but I don't think anyone has the answer to that question, unfortunately. We know that an MTHFR mutation is a component, and it's being researched and studied in a number of different diseases and disorders at this point, but we don't really know what role and the extent of that role it plays in autism specifically. I can say that we see a number of children with an MTHFR mutation, which can be appropriately treated successfully in many cases with simple nutritional intervention and make a difference in that child's life. So that's another real aspect, I think, of looking at something basic and fundamental that we can put a building block in and make a pretty significant difference in that child's ability to communicate and participate in his or her environment. Do I consider a professionally trained service or therapy dog good for children with autism? I believe that any therapy that provides support and challenge and an opportunity for a child that I serve that's provided by professionals is absolutely a good thing. We have a number of children that we serve here who have service and therapy dogs, and they've done quite well. I really encourage families to get full information on who they're working with and where their service dogs come from, and understand that service dogs and therapy dogs really aren't pets. But I can see the profound change that those do make in the lives of the children that we serve. The next question is, are there recommendations on websites or good books for proper nutrition for children with autism? I would say I would strongly encourage you to start with our website and look at nutrition there. If you send me directly an email, my email address is kbarnhill@johnson-center.org. I'm happy to help provide a list of available internet resources for you in your exploration of what appropriate nutrition is. The problem that we have right now, I think, is there are so many diverse voices out there, and no one really has the straight path. There's